Growing older brings wisdom, experience, and a lifetime of memories worth cherishing. But it also brings unwelcome changes that can slowly erode the quality of life you have worked so hard to build. Among the most frustrating and debilitating of those changes is nerve damage. If you are over 60, there is a significant chance you have already felt its effects without even knowing the cause. That tingling sensation in your fingers, the numbness creeping through your toes, the burning pain that shoots through your feet when you try to walk, the unexplained weakness in your hands that makes it difficult to open jars, button your shirt, or hold a pen. These are not simply signs of getting older, they are signs that your nerves are crying out for help. Peripheral neuropathy, the medical term for nerve damage affecting the extremities, impacts an estimated 20 million Americans. Among those over the age of 60, the numbers are staggering. Research suggests that up to 70% of older adults experience some form of nerve dysfunction, ranging from mild tingling to severe life-altering pain. For decades, the medical community treated this condition as an inevitable consequence of aging, something to be managed with painkillers and accepted with resignation. But groundbreaking research has revealed something extraordinary. One single vitamin, taken daily, has the power to not only halt the progression of nerve damage, but to actively reverse it, often within as little as 2 weeks. This is not a fringe theory or an unproven supplement claim. This is backed by decades of peer-reviewed scientific research, clinical trials, and the real-world experiences of thousands of patients who have reclaimed their mobility, their comfort, and their independence. The vitamin in question is one you have probably heard of but may have drastically underestimated. It is vitamin B12, also known as cobalamin, and its role in nerve health is nothing short of miraculous. Understanding nerve damage, what is really happening inside your body? Before diving into the solution, it is essential to understand the problem. Your nervous system is one of the most complex and vital systems in your entire body. It is the communication network that connects your brain to every muscle, organ, and tissue. Think of it as an incredibly sophisticated electrical wiring system. Your nerves carry signals at speeds of up to 270 miles per hour, telling your muscles to move, your heart to beat, and your lungs to breathe. They also carry sensory information back to your brain, letting you feel temperature, texture, pressure, and pain. Each nerve fiber is protected by a fatty coating called the myelin sheath. This sheath functions much like the rubber insulation around an electrical wire. It protects the nerve, keeps signals from leaking out, and ensures that messages travel quickly and accurately from one point to another. When this myelin sheath becomes damaged or begins to deteriorate, the consequences are immediate and often devastating. Without adequate myelin protection, nerve signals become slow, distorted, or completely blocked. This is what creates the symptoms that millions of seniors experience daily. The tingling and numbness occur because sensory signals are not reaching the brain properly. The burning pain happens because damaged nerves misfire, sending pain signals when there is no actual injury. The muscle weakness develops because motor signals cannot reach the muscles effectively. The balance problems arise because the nerves in your feet can no longer accurately sense the ground beneath you. As nerve damage progresses, the consequences become increasingly serious. Falls become more frequent, and for someone over 60, a single fall can be catastrophic. Loss of sensation in the feet can lead to unnoticed injuries and infections, particularly dangerous for those with diabetes. The chronic pain can lead to depression, social isolation, and a dramatic reduction in physical activity, which in turn accelerates the overall decline in health. The vitamin B12 connection. Why this single nutrient is so critical. Vitamin B12 plays a role in your body that goes far beyond what most people realize. While it is commonly known for its involvement in energy production and red blood cell formation, its most critical function may be its role in maintaining and repairing the nervous system. Specifically, vitamin B12 is absolutely essential for the synthesis and maintenance of the myelin sheath that protects every nerve fiber in your body. Without adequate B12, your body simply cannot produce enough myelin to keep your nerves properly insulated. Existing myelin begins to break down, and the body cannot repair it fast enough, The result is progressive nerve damage that worsens over time. But here's the remarkable part. When B12 levels are restored to optimal levels, the body can begin rebuilding the myelin sheath. Nerve function can be restored, symptoms can be reversed, and this process can begin in as little as 2 weeks. The science behind this is well established. Vitamin B12 is required for the production of a substance called S-adenosylmethionine, commonly known as SAMe. This compound is a universal methyl donor, meaning it provides essential chemical groups needed for the synthesis of myelin and other nerve protective compounds. B12 also plays a crucial role in the production of nucleotides, the building blocks of DNA, which are needed for the repair and regeneration of nerve cells. Research published in the Journal of Neurological Sciences demonstrated that patients with B12 deficiency who received supplementation showed measurable improvements in nerve conduction velocity within 14 days. The nerves were literally conducting signals faster and more efficiently after just 2 weeks of proper B12 intake. Other studies published in the European Journal of Clinical Nutrition found that B12 supplementation led to significant reductions in neuropathic pain scores, with many patients reporting a dramatic decrease in burning, tingling, and numbness. A landmark study conducted at the Department of Neurology at Kasturba Medical College followed patients with documented B12 deficiency and peripheral neuropathy over a 6-month period. Patients who received daily B12 supplementation showed progressive improvement in nerve function tests, with the most dramatic improvements occurring in the first 2 to 4 weeks. Many patients who had been experiencing severe numbness and pain reported a return of normal sensation and a significant reduction in discomfort. Why are seniors so vulnerable to B12 deficiency? If vitamin B12 is so critical, why do so many people over 60 become deficient? The answer lies in a combination of biological, dietary, and medical factors that converge as we age. Declining stomach acid production. The absorption of vitamin B12 from food is a complex process that begins in the stomach. When you eat foods containing B12, such as meat, fish, eggs, and dairy, the vitamin is bound to proteins. Your stomach produces hydrochloric acid and an enzyme called pepsin, which work together to free B12 from these proteins. Once freed, B12 binds to a special protein called intrinsic factor, which is produced by cells in the stomach lining. This B12 intrinsic factor complex then travels to the small intestine, where it is absorbed into the bloodstream. The problem is that stomach acid production naturally declines with age. By the time you reach 60, your stomach may be producing only a fraction of the acid it produced in your younger years. This condition, known as atrophic gastritis, affects an estimated 30 to 40% of adults over 60. Without adequate stomach acid, your body cannot effectively extract B12 from the food you eat. You could be consuming plenty of B12-rich foods and still be deficient because your body simply cannot absorb it. Medication interference. Many medications commonly prescribed to older adults can further impair B12 absorption. Proton pump inhibitors, such as omeprazole and lansoprazole, which are used to treat acid reflux and ulcers, work by suppressing stomach acid production. While they provide relief from heartburn, they also dramatically reduce the body's ability to absorb B12 from food. Studies have shown that long-term use of proton pump inhibitors can reduce B12 absorption by up to 75%. Metformin, the most widely prescribed medication for type 2 diabetes, has also been shown to significantly impair B12 absorption. Research published in the Archives of Internal Medicine found that patients taking metformin had B12 levels that were up to 19% lower than those not taking the medication. Given that diabetics are already at increased risk for neuropathy, the B12 depleting effect of metformin can create a devastating double burden. H2 blockers such as ranitidine and famotidine, commonly used for heartburn, also reduce stomach acid and can contribute to B12 deficiency over time. Even some antibiotics and certain seizure medications have been linked to impaired B12 absorption. Dietary factors. Many older adults naturally reduce their intake of B12-rich foods as they age. Declining appetite, difficulty chewing or swallowing Changes in taste and dietary restrictions can all contribute to reduced B12 intake. Those following vegetarian or vegan diets are at particularly high risk, as B12 is found almost exclusively in animal products. Reduced intrinsic factor production. Some older adults develop antibodies against the cells that produce intrinsic factor, a condition known as pernicious anemia. Without intrinsic factor, the body cannot absorb B12 regardless of how much is consumed. This autoimmune condition becomes increasingly common with age and can lead to severe, potentially irreversible nerve damage if not identified and treated. The warning signs you should never ignore. B12 deficiency often develops gradually and its symptoms can be subtle at first, easily dismissed as normal signs of aging. But recognizing the early warning signs is crucial because the longer the deficiency persists, the more difficult it becomes to fully reverse the damage. Here are the symptoms you should watch for: tingling and numbness in the hands and feet. This is often the first symptom and typically starts in the toes before progressing to the fingers. It may feel like pins and needles or a buzzing sensation. Burning pain in the extremities. Many people describe a sensation of walking on hot coals or having their feet wrapped in sandpaper. This pain can be constant or intermittent and tends to worsen at night. Difficulty walking and balance problems. As nerve damage progresses, proprioception, the body's ability to sense its position in space, becomes impaired. This leads to unsteadiness, particularly in the dark or on uneven surfaces. Muscle weakness. Damaged motor nerves can cause weakness in the hands and feet, making it difficult to grip objects, climb stairs, or perform fine motor tasks. Fatigue and low energy. B12 is essential for red blood cell production. Deficiency can lead to a form of anemia that causes persistent tiredness, weakness, and shortness of breath. Cognitive changes. B12 deficiency has been linked to memory problems, difficulty concentrating, confusion, and even dementia-like symptoms. Some patients have been misdiagnosed with Alzheimer's disease when their symptoms were actually caused by B12 deficiency. Mood disturbances, depression, irritability, and anxiety can all be symptoms of B12 deficiency. The vitamin plays a role in the production of serotonin and other neurotransmitters that regulate mood. Pale or yellowish skin. B12 deficiency can cause changes in skin color due to its effect on red blood cell production. If you are experiencing any of these symptoms, particularly if you are over 60, it is critical to have your B12 levels checked immediately. A simple blood test can reveal whether deficiency is contributing to your symptoms. How vitamin B12 reverses nerve damage. The science explained. The ability of vitamin B12 to reverse nerve damage is rooted in several distinct but interconnected biological mechanisms. Myelin sheath regeneration. As previously discussed, B12 is essential for the synthesis of myelin. When B12 levels are restored, the body begins producing new myelin to replace what has been lost. This process, known as remyelination, can restore the insulation around damaged nerve fibers, allowing signals to travel at normal speed again. Research has shown that remyelination can begin within days of B12 supplementation and continues progressively as long as adequate levels are maintained. Nerve cell repair and regeneration. B12 supports the production of nucleic acids needed for DNA synthesis and repair. This means that when B12 levels are optimal, the body can more effectively repair damaged nerve cells and even generate new ones. While the nervous system has limited regenerative capacity compared to other tissues, B12 provides the biochemical support needed to maximize whatever regeneration is possible. Reduction of homocysteine. B12 is a critical cofactor in the conversion of homocysteine to methionine. When B12 is deficient, homocysteine levels rise. Elevated homocysteine is a known neurotoxin that damages blood vessels, reduces blood flow to nerves, and directly injures nerve tissue. By lowering homocysteine levels, B12 supplementation removes a major source of ongoing nerve damage, allowing healing to begin. Anti-inflammatory effects. Chronic inflammation is a significant contributor to nerve damage in older adults. B12 has been shown to have anti-inflammatory properties, helping to reduce the inflammatory processes that contribute to nerve deterioration. By dampening inflammation, B12 creates a more favorable environment for nerve repair and regeneration. Enhancement of nerve growth factor. Some research suggests that B12 may enhance the production or activity of nerve growth factor, a protein essential for the survival, growth, and maintenance of nerve cells. This effect could further accelerate nerve repair and help protect remaining healthy nerves from damage. Choosing the right form of B12. Not all supplements are equal. One of the most important things to understand about B12 supplementation is that not all forms of the vitamin are equally effective. There are four main forms of B12 available as supplements, and they differ significantly in their bioavailability and therapeutic potential. Cyanocobalamin. This is the most common and least expensive form of B12 found in supplements. It is a synthetic form that must be converted by the body into its active forms before it can be used. While cyanocobalamin is adequate for maintaining basic B12 status in younger, healthy individuals, it may not be the best choice for older adults with absorption issues or existing nerve damage. The conversion process requires energy and certain enzymes that may be less available in aging bodies. Methylcobalamin. This is one of the two active coenzyme forms of B12 and is the form most directly involved in nerve function. Methylcobalamin does not require conversion and is immediately available for use by the nervous system. Research has consistently shown that methylcobalamin is superior to cyanocobalamin for nerve repair and regeneration. A study published in the Journal of the Neurological Sciences found that methylcobalamin promoted nerve regeneration more effectively than other forms of B12 and was associated with greater improvements in nerve conduction velocity. Adenosylcobalamin, also known as dibencoxide, this is the other active coenzyme form of B12. It plays a primary role in cellular energy production within the mitochondria. While important for overall cellular health, it is less directly involved in nerve repair than methylcobalamin. Hydroxocobalamin. This is a natural form of B12 that is well retained by the body and is commonly used in injectable forms. It serves as a precursor that can be converted to both methylcobalamin and adenosylcobalamin. It has excellent bioavailability and is a good choice for those who need sustained B12 levels. For the specific purpose of reversing nerve damage, methylcobalamin is widely regarded as the gold standard. It is the form that has been most extensively studied for neurological applications and has consistently demonstrated the greatest benefits for nerve repair, pain reduction, and functional improvement. Optimal dosage for nerve repair. The recommended daily allowance of B12 for adults is 2.4 micrograms. However, this amount is designed to prevent outright deficiency in healthy young adults, not to reverse existing nerve damage in older individuals. For therapeutic purposes, significantly higher doses are typically needed. Clinical studies on B12 for neuropathy have used doses ranging from 500 micrograms to 5,000 micrograms daily, with most showing optimal results at doses of 1,000 to 2,500 micrograms per day. Because B12 is a water-soluble vitamin, excess amounts are simply excreted in the urine, making it extremely safe even at high doses. There is no established upper limit for B12, and toxicity has not been reported even at doses far exceeding therapeutic recommendations. For older adults seeking to reverse nerve damage, most integrative medicine practitioners recommend starting with 1,000 to 2,500 micrograms of methylcobalamin daily. Sublingual tablets, which dissolve under the tongue and allow the vitamin to be absorbed directly into the bloodstream through the mucous membranes, are preferred over standard oral tablets because they bypass the digestive system entirely. This is particularly important for those with reduced stomach acid or intrinsic factor deficiency, as it eliminates the absorption barriers that may have caused the deficiency in the first place. For cases of severe deficiency or advanced neuropathy, some physicians recommend starting with B12 injections to rapidly restore levels, then transitioning to high-dose sublingual supplementation for maintenance. What to expect? A timeline of recovery. While individual results vary depending on the severity and duration of nerve damage, The general timeline of recovery with B12 supplementation follows a fairly predictable pattern. Week 1. During the first week of supplementation, most people notice improvements in energy levels and mental clarity. The fatigue and brain fog associated with B12 deficiency often begin to lift within days. Some individuals also report a reduction in the intensity of burning pain, though nerve-specific improvements may not yet be noticeable. Week 2. This is when nerve-related improvements typically begin to emerge. Many people report a noticeable reduction in tingling and numbness, particularly in the hands. Some experience a reduction in the frequency and intensity of burning pain in the feet. Nerve conduction studies performed at this stage often show measurable improvements in signal transmission speed. Weeks 3 to 4. Improvements in nerve function continue to accelerate. Balance and coordination may begin to improve as proprioceptive nerves start to recover. Fine motor tasks that had become difficult may start to feel easier. Sleep quality often improves as nighttime pain and discomfort diminish. Months 2 to 3. More substantial improvements in sensation and motor function become apparent. Many people report a significant or complete resolution of tingling and numbness. Muscle strength in the hands and feet may improve. Walking becomes steadier and more confident. The overall quality of life improves dramatically. Months 4 to 6. For those with moderate to severe nerve damage, this is when the full extent of recovery typically becomes clear. While complete reversal of all symptoms is not always possible, particularly in cases of long-standing or severe damage, most people experience a significant and meaningful improvement in their symptoms and functional abilities. It is important to note that B12 supplementation is not a cure that works once and then can be stopped. Because the underlying factors that cause the deficiency, such as reduced stomach acid, medication use, and dietary limitations, typically persist. Ongoing supplementation is usually necessary to maintain the benefits and prevent recurrence. Complementary strategies to maximize nerve repair. While vitamin B12 is the single most impactful intervention for reversing nerve damage in deficient individuals, several complementary strategies can enhance and accelerate the healing process. Alpha-lipoic acid. This powerful antioxidant has been extensively studied for its benefits in peripheral neuropathy. Alpha-lipoic acid protects nerve cells from oxidative damage, improves blood flow to nerves, and enhances nerve signal transmission. Studies have shown that doses of 600 milligrams per day can produce significant improvements in neuropathic symptoms. When combined with B12, the effects can be synergistic. Folate, vitamin B9. Folate works closely with B12 in methylation reactions that are critical for nerve repair. Adequate folate levels ensure that B12 can function optimally. Many practitioners recommend taking a B-complex supplement that includes active folate, methylfolate, along with methylcobalamin to maximize nerve repair. Vitamin B6, another B vitamin that plays a role in nerve health. B6 is involved in the production of neurotransmitters and the maintenance of nerve function. However, caution is warranted with B6 supplementation, as excessive doses, typically over 200 milligrams daily, can actually cause nerve damage. Moderate supplementation as part of a B-complex formula is generally safe and beneficial. Vitamin D emerging research has identified a strong connection between vitamin D deficiency and peripheral neuropathy. Vitamin D plays a role in nerve growth factor production and has anti-inflammatory properties that support nerve health. Many older adults are deficient in vitamin D, and supplementation may provide additional support for nerve repair. Omega-3 fatty acids. The anti-inflammatory properties of omega-3 fatty acids, found in fish oil and flaxseed oil, can help reduce the chronic inflammation that contributes to nerve damage. Some research suggests that omega-3s may also support myelin production. Regular physical activity exercise increases blood flow to the nerves, which supports healing and regeneration. Walking, swimming, tai chi, and gentle yoga are all excellent options for older adults. Exercise also helps maintain muscle mass, improve balance, and reduce the risk of falls. Blood sugar control. For those with diabetes or prediabetes, Maintaining tight blood sugar control is essential for preventing further nerve damage. High blood sugar levels are directly toxic to nerve cells and can undermine the benefits of B12 supplementation. The scientific evidence supporting B12 for nerve repair is compelling, but the human stories behind the research bring the data to life. Margaret, a 68-year-old retired schoolteacher from Ohio, had been suffering from severe numbness and burning pain in her feet for 3 years. She had difficulty walking more than a block and had given up her beloved gardening because she could not feel the ground beneath her feet. Her doctor attributed her symptoms to aging and prescribed gabapentin for pain. The medication helped slightly, but left her feeling drowsy and foggy. When a new physician checked her B12 levels, they were found to be critically low. She began taking 2,500 micrograms of methylcobalamin daily. Within 10 days, she noticed the burning in her feet had significantly diminished. By the end of the second week, she could feel the texture of her carpet under her toes for the first time in years. 3 months later, she was back in her garden, kneeling in the soil, feeling every pebble and root beneath her fingers. Robert, a 72-year-old veteran from Texas, had been experiencing progressive weakness in his hands and frequent falls due to poor balance. He had been taking metformin for diabetes and a proton pump inhibitor for acid reflux, both medications known to deplete B12. His blood levels revealed a severe deficiency. After starting B12 injections followed by daily sublingual supplementation, his hand strength improved enough to resume his woodworking hobby within 3 weeks. His balance improved steadily over the following months, and his fall frequency dropped from several times a month to none. These stories represent thousands of similar experiences reported by patients and clinicians around the world. They illustrate the profound impact that a simple, inexpensive vitamin can have when the root cause of nerve damage is identified and addressed. A simple solution to a complex problem. In a world of expensive medications, complex treatment protocols, and overwhelming health information, there is something profoundly encouraging about a solution this simple. One vitamin, one pill a day. Measurable improvements in as little as 2 weeks. It seems almost too good to be true, but the science is clear, the evidence is strong, and the experiences of thousands of patients confirm it. Vitamin B12 is not a miracle cure for all forms of nerve damage. It is not a replacement for comprehensive medical care, but for the millions of older adults whose nerve damage is caused or worsened by B12 deficiency, it represents a safe, effective, affordable, and scientifically validated path back to comfort, function, and independence. If you are over 60, do not accept nerve pain, numbness, and weakness as an inevitable part of aging. Do not settle for medications that merely mask symptoms while the underlying problem continues to worsen. Take the simple step of getting your B12 levels tested. If they are low, even borderline low, start supplementing with methylcobalamin today. The nerves that are crying out for help may begin to heal faster than you ever thought possible. Your body has an extraordinary capacity for repair and regeneration, even in your 60s, 70s, 80s, and beyond. Sometimes all it needs is the right raw material to do its job. Vitamin B12 may be the single most important piece of that puzzle, and it has been waiting on the supplement shelf for you all along.